Good afternoon, everyone. I would like to welcome you to session 10A, Identification of the Perceptual Characteristics and Personalized Educational Progressions for Children with Deafblindness and Other Severe Complex Disabilities. Please allow me to introduce you our speakers who are joining us virtually through technology this afternoon. They couldn't be here live, but they will be on the screen for us. And now I'm going to tell you a little bit about them. It's quite difficult, so allow me to read it slowly. Alina Koklova, psychologist, PhD in psychology, associated researcher at Grapes in France. She worked at the Resource Center supporting persons with deafblindness and their families, Yaseneva Poliana, created by the Foundation Connection, and at the Moscow State University of Psychology and Education, where she was involved in the supervision of students and trainings on sensory impairments, multiple disabilities and alternative communication. Cédric Moreau is an associate professor in educational sciences at INSHEA in the Grapes Laboratory in France. PhD in linguistics related to sign language and a master's degree in technology and disability. His work focuses on conceptualization and access to knowledge for deaf and deafblind children. He coordinates the research, identification of perceptual specificities and personalized educational programs for children with deafblindness and other severe complex disabilities, funded by FIRA, leads the multilingual and multimodal collaborative project OCEL, I think it's pronounced like that, and co-coordinates the Observatory of Adapted Digital Resources. Please welcome Alina Koklova and Cédric Moreau.
Hello.
We can't see you, but we can listen you.
Yes. Hello, everyone.
Hello.
We are very happy to be able to present our work to you today, even online and even in a black screenshot. It's a little bit strange, but we had a little problem with the visa of my beautiful wife. Yeah.
Yes, it was a little bit difficult, yes, and the most terrible that I received it, but it was one day later than we should fly. So anyway, it was planned not like this. It was would be much easier to exchange face to face and to be with you there. But it is as it is, and we will try to present you online. I propose it's a little bit difficult to manage interactions when we don't see you, and I propose that we talk a little bit about our work, and maybe after we can propose some time for discussion. We will see how it will be.
So this is a research project funded by FIRA, which is the International Foundation for Applied Research on Disability. And this research is being carried out in France and Russia and concerns the identification of perceptual characteristics and personalized educational progressions for children with deafblindness and other severe complex disability. So I will change slide like this. No, like this, yes. And you have a list of partners. In addition to our institute, INSOE, which deals with the issues of access to knowledge for children with special educational needs, there's CRESAM, also centers for the blindness in France, and I think several of its members are in Ottawa this day. On the Russian side, we have the Yaseneva Poliana Resource Center for the blind people and their family in Moscow. Pronunciation is good. Yes,
Yes.
Yes, good. but also the community of families of the blind and the Center of Creative Education. In France, establishments for children with dual sensory impairments have also helped us. The Institute of Sensory Education for Children with Visual Impairment, IDES, and the Institute of Deaf Children in Bourg-la-Reine. And I understand that Elodie Tiercelin, who welcomed us at this institute, was also in Ottawa. So that's leaving a conference by proxy. We are mainly interested in children with deafblindness and children with other disability.
Complex and multiple disabilities.
Yes. And the aim, sorry. The aim of our project is to summarize and generalize parental experience, knowledge of professional and scientific, in order to develop structural protocols for identifications of visual and hearing perceptual possibility in children with the blindness and with other complex disability. Identification is based on behavioral reactions, and the aim is to enable parents and professionals to describe in detail the child ability profile to modify the environment according to his needs and to propose an individual curriculum. So we have two hypotheses. The first hypothesis, not hypothesis, yes. The first hypothesis is that the structure and detailed analysis of children's behavior during free and organized activity enable a reliable assessment of the significant specific of their auditory and visual perception without strict reference to medical diagnosis. Change in the characteristic of visual and hearing stimulations as a function of a child response should determine an increase in the repertoire of behavioral reactions. Those detailed assessments is primarily aimed at describing conditions that improve the child's perceptual abilities and meet his perceptual needs. And the second hypothesis is that the result of the proposed assessment model can become an effective basis for the creation or modification of individual educational programs. The study carried out in France and Russia, I said, involves 25 children aged between 0 and 6, and they may have different degrees of visual and hearing impairments, different levels of cognitive and language skills. Functional assessments of individual perceptual characteristics is particularly important for two groups of children.
Yes, and I will try to describe for whom we think that our propositions could be the most interesting. We see that in institutions for children with different multiple and complex disabilities, the children with dual sensory impairments are a little bit lost. And we see many children with multiple disabilities whose parents and teachers, the professionals who work with them, they don't understand, and they can't say what and how the child can see and hear. And we think that our project could be interesting for first the children who have severe intellectual, motor, or autistic disabilities, and in their context, the hearing and visual impairments are not diagnosed, or where these impairments can be supposed, but it is difficult to clarify their degree and specificity. We don't know what the children can see and hear. We don't know exactly if they have or don't have visual and hearing impairments. And the second group of children for whom can be interesting to participate in our project. It is the group of children where blindness or deafness or deafblindness has been considered, and the child's usual behavior corresponds to these states. But under certain conditions, the child seems able to respond to visual and acoustic stimuli. And this proposition to evaluate the visual and hearing abilities of these children comes from practice, because we see enough cases when the parents, even parents, they suppose that the child is blind, but the professionals, we can see, we can remark some reactions, and we can develop and make these reactions more how to say, consent, and the child can learn a little bit to use his vision and hearing in his everyday life. And to identify the children who need special attention according to his to the specifics or their visual and hearing and acoustic perception, we propose some instruments. First, it is the questionnaire for parents, which includes the questions, many questions on the symptoms, on the manifestations of their child's peripheral and central visual and hearing impairments, even if they are not diagnosed, and even if the parents don't know that it can be the case of their child. And we propose also 3 observation protocols. First observation should be conducted in a free situation, in the free activity of the child. It can be at home or in the classroom. And we just try to remark the most of his reaction on at the visual and acoustic stimuli, and describe them. And to other protocols, there are little tests when we propose a child to look the objects with and faces with different characteristics, to listen the voices and sounds with different characteristics. And this is registered on video. And after we analyze the videos to be more or less sure that we interpret correctly the children's behavioral responses. When we started this project, now it is still in progress, so we made a half, I think. We started with composing of the list of behavioral manifestations related to vision and hearing abilities. And first we studied the literature. We made a literature review where we learned about symptoms and characteristics of peripheral and cerebral visual and hearing impairments. And at the same time, on parallel way, we organized some working groups of parents and professionals in Russia and in France to discuss the observations of people who live and who work in the field with children with dual sensory impairment, with sensory impairments and with other disabilities, and we try to sum up their observations about the visual and hearing behavior of their children. And at the end, we described 11 parameters of for assessment of the visual behavior of the child. We don't list all because it's impossible to read and difficult to hear, but we give just some examples. For example, it is just the specifics of visual response of the child, how he looks and how we can understand that he sees or he looks at something. Another characteristic, it is the ability to fix on faces or on objects, and which object the child can detect and fix. For example, it can be the objects of special size or color. It can be the moving object, or it can be the sounding object. For example, when the sound helps to attract the visual attention of the child. And we also looked how the child reacts to familiar object and unfamiliar object, familiar faces and unfamiliar faces. And one more characteristic, it's the latency in visual response. And we try to count in seconds the time which the child needs in average to detect and to react to a visual stimuli, and if this time changes during our tests. Another characteristic is the visual complexity. It's important characteristics for cerebral visual impairments. If the child can react and can remark the stimuli, the visual stimuli, which are simple, for example, one object on contrasting background, or how he can see, how he can react to many objects at the same time, or at the object on the complex, for example, colored background. And other characteristics, you will see some of them a little bit later. To describe the reactions to the auditory stimulation, we propose to focus on specifics of behavioral responses, how the child reacts to the sound. He can, for example, demonstrate the reaction of orientation when he stops his activities and tries to listen to the sound. It can be the ability to localize the source of sound, or just the attempts to find it. It is also the time of reaction, if the child can react immediately to the sound, or he needs some time to show his reaction. We also tried to describe the reactions to the different sounds with different characteristics, the volume, the height of sounds, and also to describe how the child reacts to the new sounds and to familiar sounds, new voices and familiar voices. And another parameter which is important, how the child can treat the simultaneous acoustic and visual stimulation. And yes, it's very, very short because the protocols and the questionnaires, they are very big, and it's impossible to show you all, but we are always ready to exchange after after the presentation. We want just to present you one young boy. His name is Jean. He is 5 years old. It is one of children who we already observed, and we propose you this case first because Jean is always ready to work and always ready to show what he can do. It was easy to work with him and to interact with him and to propose him, and he was always in interaction. And another reason it is because his parents gave us authorization to exchange with professionals, with professional community, and we have right to present you to present you this boy. I will tell you a little bit about him, and after we will come closer to the results of our observations of what we propose. Yes, we will also tell you what we propose to work with Jean in the future. Jean, he's 5 years old, and he was recognized as blind. His visual impairments are related to brain functioning, and the doctors, they say that it's impossible for now to measure his visual acuity, and they think that his vision should develop with time, but for now it's very difficult to explain to his parents what exactly he can see and in which condition. Jean, he has no diagnosed hearing impairment, but we will see a little bit later that his behavior is not how to say, when he can hear the sounds and he reacts well to the sounds, but it is difficult to him to use his hearing for orientation in his environment. What I would like to tell about Jean, first to describe a little bit his situation. He has also motor impairment, motor disability. He can't move by his own, but he can sit with support, and you could see the picture of him when he is sitting in his red chair. Yes, and very happy to interact with with people. He can hold his head upright, but for a short while. It is difficult to him to support this position, and very often he tilts his head forward. He can lift his arms, and with a little difficulties, he can catch big toys. Usually he uses his right hand more effectively than his left one, and he almost never brings his hands together, and he can't hold the objects with both hands. He can reach out his hand to touch a person or an object, but he can't find them immediately. We suppose that it's due to both motor and visual difficulties. He sometimes can tap his foot on his chair. But he can't walk, yes, and he can't move on his own. What is important that movement of his eyes are also difficult, and he often rolls his eyes when he makes efforts, and it's difficult for him to synchronize both eyes to follow the movement of an object. Jean is very interested in objects and people, and shows a high level of motivation, curiosity, and drive. He always reacts happily when we approach him and when we propose him something, and he dislikes to stay alone without communication partners. He never tries to avoid or protest against any activities. He interacts with others through vocalizations and expressive emotional reactions. He can laugh, he can smile, he can move actively. He likes a lot physical contact and tries to touch the communication partners with his hands to catch. He tries to catch you when you are in front of him. He understands when he call him by name, and he reacts to the voices of people he knows, familiar people. And he, I suppose that he can understand some simple phrases in the context of the situation. He presents some auditory and tactile autostimulations. He puts all what we can catch to his mouth. He pulls his hair and the hair of others. He taps objects and throws them just to hear the sound. Sometimes before to throw something, he can bring an object in front of his eyes. And it was one of first signals that maybe he can look at something, maybe he can see something. Here we can see the all characteristics which we observed in Jean's behavior, the characteristics of his visual and acoustic reactions. And before to show you a little videos, I would like to explain what we can see, because when we don't see you, when we are not in front of you, it is a little bit difficult to stop video in a good moment and to attract your attention. So we will say in advance, and after maybe I will be able to comment in the process. We will see. I don't know how it can happen. First, we will see just how he looks at the objects and how his visual responses look like. We will see the specifics of fixation. We will see the delay in his visual response. We will see how he tries to touch the objects which he detected by his vision. And we will see the effect of simultaneous tactile stimulation when he sees and when he has the tactile sensation. I hope that it will be possible to catch it on the video. We will try to see. Doesn't work?
Doesn't work.
You should give the vocal. It starts. Jean. Oui. Tu m'as frappé? Tu as frappé mes cheveux? Tu peux me regarder? Tu peux me trouver avec tes yeux? And now he looks. We didn't see the touch. Yes. We will. No, it's not.
When you.
It's not.
One more time.
Oh, we can try, yes, to see one more time.
Sure.
So he looked at me a little.
Jean. Oh oui. Tu m'as frappé? Tu as frappé mes cheveux? Tu peux me regarder? Tu peux me trouver avec tes yeux?
Yes, and here I blow at his face a little, and he looks at me. When he has a tactile sensation, he tries to find its source by his eyes. So here we can make some comments. It is little short part of the videos which we took with Jean. But we see that Jean doesn't always react to visual stimuli, and he doesn't always, it is not always clear to others what he looks and what he can see. And his visual reactions are most remarkable if we are close to him or we show him the objects close to him. We can see it also a little bit later with objects. When he remarks something, he tries to catch it with his hands. He wants to take immediately. We propose for Jean to show him objects, to show him faces when we communicate with him, close to him, and give him enough time to react, to see us. We should say that the most clear indication that he has seen the object or the person when he tries to take it or to touch it with his hands. We propose to his close people, to his family, to show him all objects of his daily life before to use them. The spoon before to feed him, the pampers before to change them, the teeth brush before to clean his teeth, and his toys. When we talk about fixation, sometimes he can fix almost directly on an object or on a face. But sometimes he turns his head to the right and moves his eyes to the left, or he looks like sideways with his head tilted slightly downwards. And we in discussions with his family, we try to accent that if Jean doesn't look directly, it doesn't mean that he doesn't see anything. It doesn't mean that he doesn't look. And it doesn't mean that the object or the person is not interesting to him. We should give him an opportunity to adjust his eyes as it is comfortable to him, and wait until he reacts, until he tries to reach out his hand to touch. And in this case, we will be sure that he has seen something. About the delay of visual response, about the latency. He reacts to visual stimuli with a remarkable delay, and it takes him usually to fix a few seconds. He reacts to the faces with a bigger delay than to the objects, and it takes approximately, in average, 8 seconds. And he reacts faster and looks longer at the familiar faces than at the new faces. And it is also important to notice that the visual response, the time of his visual response decreases if Jean is already expecting to see something. So during our interactions with him, we had shown him many objects, faces, familiar and unfamiliar, and with time he reacts faster because he expects that we will show him something. And it's an important factor. When he's ready to look, he reacts faster. First, we should take into account the time of reaction yes, we have 5 minutes, sorry. We should give him enough time to react, to fix, to see the object. And second, taking into account that his reaction time decreases, maybe it makes sense to make him with him a little visual training regularly for 5-10 minutes, and it will give him the regularity, and he will expect that that he can see something and that it makes sense.
Which one?
Change.
Do you hear
and-
me, Alina? Sorry to interrupt you.
Yes.
We have got 5 minutes left, including questions. So maybe you could finish in a little while, then we have some room for questions left.
Yes. We will
Thank
show
you.
one more little video, and after we'll go to the questions.
Thank
Yes,
you.
we want to show, okay, it is maybe the most interesting. We will show one more little video about the reaction to the visual and auditory stimulation simultaneously.
Fine, thank you.
Just this is the object shiny, yes, and Jean, he can remark it fast. But when I tap at the object, he stops to look. And yes, it's little moment, but it is very typical for Jean to react like this. He just listens, but he doesn't look, and he has no reflex to turn his head to the sound and to try to find the source of sound. We propose to attract anyway, to try to attract his visual attention by sound, but it is important that we say something and we stop, or we make a sound with an object and we stop. And after, Jean is motivated to find this object with his eyes. And it works very good like this with him. It was finished. So to conclude very quickly, just it is one case, and we proposed for Jean, for professionals who work with him, and for his family, the recommendations how to work with his vision in his everyday life, and how to take into account his visual characteristics and the interaction between his vision and hearing to make this world around him, yes, his environment, more accessible for him. And after we will describe many other cases and make some conclusions about more typical and more individual perceptual needs of children, and make little guidelines about how to use the observations and how to modify the programs, educational programs for children, and everyday environment to take into account, yes, their possibilities, and to develop them a little bit. We are ready for questions. It's you, says.
No.
But
We'll see. One minute of question.
we started.
Okay, sorry. Maybe you hear me now? Yes.
Yeah.
Yes, yes.
Okay. Thank you for your wonderful presentation, Alina and Cedric. Maybe we have some questions from the audience. Yeah? Yeah. Sorry, you can maybe ask it here. I don't.
Yeah, that's it.
There's no. I don't have a mic. Ah, great.
If you could maybe to repeat for us, because like this we don't hear anything.
Yeah, they just gave me the mic. Can you hear me now?
Yeah.
Yes, yes, it's better.
I just have a question basically about funding. When you go in, you do all this work, you get the assessment for them. Is it easy for them to get this implemented, or is there boundaries? I know a lot for us, funding is a big deal. Like, we have great ideas, but funding doesn't always back that up. I don't know how your country works or like that, or if you guys have access to that. They cut me off. They're done with me.
Oh, sorry, we didn't understand the question. Maybe you could repeat a little bit slower. Yes, I understand that it was about funding.
Yes, funding.
If it was easy for us to have the funding for the research.
Well, after your research, so you guys are doing all this research, you give them the information that child needs. Is there funding to carry that on for them so they can actually get the resources afterwards? I think.
Still didn't understand.
Bonjour Cédric, Alina. C'est Sonia.
Salut, Sonia.
Salut, salut. Et donc la question, c'est plutôt de savoir si ce projet est fini et pour l'après, pour l'implémentation, est-ce qu'il n'y aura pas besoin d'avoir aussi un financement? Comment ça, si le projet est fini, comment donner une suite, comment procéder si possible, hein,
Yes,
l'implémentation?
It's life for French research. You should catch other project to spread, but
I don't think.
Attends, inside this project, we should spray some 20 cases with all material for experiment. So we should spread this free because it's inside project. And after all guideline, all things are in open data, and we will spread this free. So after this, we should, yes, we imagine other project, but to this, it will be finished.
It will be our job will be finished, but all what we propose, it will be available in open access, and yes, and we will use it. And I think professionals who work with us, they will also use it. So I think it will be spread. And I don't think that we need a new special funding to support this. Always the professionals who are interested, they can use it, and it will be free for them, and it will be easy for them, because even if they don't have ready boxes of materials, it is the materials which were imagined easy to find at the shop. Toys of I don't know, things for the house which are easy to find and not very expensive to buy.
Yes, because we will describe properties of materials in the box, which is important for our research. And yes, and with each institution with whom we work, we explain results still, and for children we find. So there is a different degrees. We explain each times, and after we make a training for all the teachers. and all professionals who are interested in following this. So,
Okay. Thank you very much also for the French translation.
merci so much.
Yes, thank you, Sonia.
And thank you, Alina and Cedric, for your presentation on making an educational program and on making a guide for parents so that they can make a profile of their children or of their child with deaf blindness at home. Unfortunately, you are not here, so we will send you our appreciation, and I would like them to give them a big applause.
Thanks.
Um,
Goodbye.
Goodbye. We will now enjoy a 30-minute refreshment break in the foyer outside this room. And during the break, please visit with our exhibitors and Group D posters. They will also be presented. After the break, please return here to the Canada Hall at 2:45 for our final plenary session for the day, and where we will learn from Professor Saskia Damen on building expertise with communication partners of people with deafblindness. So thank you very much and enjoy your break.